This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Tuesday, August 4th. This is Africa 54. Due to the global outbreak of coronavirus, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate you staying with us on Africa 54. When a journalist in Benin announced on Facebook that she was tired of sexual harassment in the workplace, her post went viral. Angela Pidger is sparking discussion in and beyond the West African countries' newsrooms. Now she's encouraging other women to come forward and help fight the problem. Xavier Fagbo reports from Benin.
Angela Pidger, a health journalist from Benin's national television station, ORTB, set off a national dialogue with a Facebook post in May. She wrote, "Sexual harassment in the workplace, even in this day and age, is still tolerated, leading to humiliation of all kinds and lower self-esteem, rape, sexual harassment, and mental abuse. I am tired of it." So she started a web-based association called Don't Be Afraid that serves as an online support group.
After my denunciation, I observed that 3 out of 5 women were harassed in the workplace. Don't Be Afraid is a nonprofit association that would like to be a listening center for all these people. All these girls who are harassed in professional and student environments, to provide them with psychological and legal support as well.
The association's Facebook and Twitter pages are gaining followers. The outlet is giving internet users a place to express themselves, to challenge social pressures, and to bear witness. Women leaders say the pages are sparking a conversation.
The young girl in African society, at least in Benin, is for the most part afraid of social pressure, afraid of what will be said. I already find it beneficial that there is this movement, not to be afraid. We must pray that it does not run out of steam, that it does not die, that it continues over time.
Advocates for women's rights say they hope Angela Pidger's speech will lead to change.
Even if it's no longer zero harassment, we're sure the rate will go down. Angela's denunciation must change something and will change something. In the professional environment, the situation has already changed.
In early May, after meeting with Pidger, President Patrice Talon condemned sexual harassment. During a work session with public media officials and some members of his administration, Talon announced plans to improve the working environment for women and to create ways to report misconduct without fear of reprisal. For Xavier Fagbo in Cotonou, I'm Gaby Dorsil in Washington.
Despite vaccines in development, the World Health Organization chief is cautioning that the treatments have yet to prove effective and might only convey protection for a short time. Here is Zachary Goldman.
The World Health Organization warned on Monday that despite strong hopes for a vaccine,
there is no silver bullet at the moment, and there might never be.
The Director General of the WHO said there were concerns that vaccines might not prove effective or that they might convey protections for just a few months. He said, for now, stopping outbreaks hinged on the difficult task of testing, tracing, and social distancing. According to a Reuters tally, more than 18 million people around the world are reported to have been infected with the disease, and 688,000 have died. With cases spiraling globally, the fatality rate appears to hover somewhere below 1%. But Maria Van Kerkhove, the WHO's lead technical expert on COVID-19, emphasized that number still reflects a global cause for alarm.
That may not sound like a lot, but it is quite high. If you think about a virus that can transmit readily, that can transmit well,
The UN body's Emergencies Program Director said that nations with particularly high transmission rates, such as Brazil and India, needed to gird themselves for a grinding fight against the novel coronavirus.
The way out is long, and it requires a sustained commitment to doing many what on the face of it are very simple things, but are difficult to actually implement.
The United States remains the global epicenter of the pandemic, with more than 4.5 million cases and north of 155,000 deaths.
It's not our job to tell the US what it should be doing at subnational level.
The World Health Organization declined to comment on Washington's response to the crisis, but said that while the science was clear, leaders weren't always willing to listen.
The difficulty for us all is sometimes we know the right path. The difficulty is choosing to walk it.
Reuters' Zachary Goldman with that report. A probe is underway in South Africa after anti-corruption watchdog says it's looking into irregularities in coronavirus-related offers, the latest in a series of scandals that trade unions say show the government's failure to tackle graft. The inquiries by the public protector come after special investigators launched separate investigations into the procurement of COVID-19 personal protective equipment in Gauteng province. President Cyril Ramaphosa staked his reputation on fighting graft when he replaced Jacob Zuma more than 2 years ago. However, he is now on the defensive following media allegations that politically connected individuals have drained the country of millions during the coronavirus pandemic. In a weekly newsletter, Ramaphosa promised the nation that his administration would, quote, finally deal with the entrenched patronage networks that enable government employees to bid for state contracts through their friends and relatives. South Africa is approaching 517,000 COVID-19 infections, the most in Africa, with the number of infections continuing to increase. Kenyan healthcare providers say cancer patients are being greatly affected by restrictions to help contain the coronavirus and its impact on the economy. According to physicians, COVID-19 has made access to treatment extremely difficult. So far, Kenya has more than 22,000 COVID-19 cases and has reported about 370 deaths. VOA correspondent Maria Madiallo reports.
39-year-old Margaret Muwangyi is a mother of a 16-year-old cancer patient who has had recurrent brain tumors since he was 4. Through the years, he's lost his eyesight and had to drop out of school. These days, the mother says she's worried he won't get the care he needs because so many resources are going toward treating COVID-19 patients.
I am very worried, as I do not know if he will wake up tomorrow. I am worried about his future. When one goes to hospital, the doctors only seem to majorly concentrate with COVID-19 patients. We feel neglected.
Advocates say the pandemic is taking its toll on many cancer patients in Kenya. Lockdowns to combat the spread of the coronavirus have, according to some doctors, limited access to cancer facilities. Catherine Wachira chairs the NGO, Kenya Network of Cancer Organizations.
A large number of the oncologists we have in Kenya today are based in Nairobi. What this means is that patients from all over Kenya will have to come all the way to Nairobi to see these oncologists. With the lockdown measures in place, due to the COVID-19 crisis, it becomes a challenge.
Wachira notes that social distancing measures due to the pandemic limit how many patients are allowed in hospitals. Many patients have also lost their jobs.
With the loss of income, they are not able, not only just not to buy their drugs, but also to get proper nutrition. Now, when a patient is undergoing chemotherapy or radiotherapy, it is quite crucial and quite vital that their nutritional needs are well met.
That's what happened to Muwangyi. She earned $5 a day from a grocery business, which failed due to the recent economic downturn. Now she's trying to make ends meet by weaving table mats, but sales are slow. At Nairobi Hospital, an oncologist says some patients don't go to the hospital at all because they're afraid of contracting the virus.
That has also limited access to cancer treatment and diagnostics. Routine screening of mammograms and pap smears has also gone down because of this fear.
Nairobi Hospital is one of the leading private facilities that treats cancer patients in a country that has a shortage of specialists. Currently, doctors here say there are only 30 medical, surgical, and radiation oncologists in all of Kenya, making the ratio of patients per cancer specialist about 1 to 5,000. Mariama Jallo, VOA News.
There are several ways to limit the spread of coronavirus, such as washing hands and social distancing. But people living with dementia struggle to remember these precautions to fend off a disease that is particularly deadly to the elderly. Mohammed Yusuf reports from Kakamega, Western Kenya.
81-year-old Azibeta Likhaya constantly forgets her favorite verse in the Bible. Her son reminds her. The mother of 10 has dementia, a degenerative and incurable condition that affects 61,000 Kenyans, 2.5 million people in Africa, and 50 million people worldwide. She tries to follow the routine, but sometimes she forgets to wash her hands. It is not her fault, he says. But she is reminded when she forgets to follow the routine. We set the alarm on her phone, which reminds her what to do at a certain time. The World Health Organization defines dementia as a disorder in which there is a deterioration in memory, thinking, behavior, and the ability to perform everyday activities. People with dementia, like Azibeta Likhaya, are at greater risk from COVID-19 not only because they don't remember safety precautions, but also due to their age. COVID-19 is most likely to be deadly to those over age 60 years.
So it is very important that as a counselor, as a community worker, we come to them, we visit, and of course we maintain the social distance the way we are doing it, and try to help them understand the changes with the season. Because they need to understand that the season has changed, and there's so much that is happening that is beyond our control. We need to tell our patients that their immunity already is compromised. And if we allow corona in their homes, then it will not be a good situation for them.
Elizabeth Mutunga is the founder of Alzheimer's and dementia organizations in Kenya.
Okay, most of the people we work with, unfortunately, when they come to us, are usually in the middle stage and towards the late stage of dementia. So a lot of them, we can't do much with them. But with the caregivers, we give them tips on how to do this. And we are having fortnightly calls, Zoom calls with the caregivers to give them tips on how to care for their loved ones.
The health precautions and restrictions due to the virus have helped people know each other's health needs.
We have issues on positive side on this, in the sense is that people, families are noticing the cognitive dysfunction in the elderly because they're spending more time with them indoors at home.
As populations age, the World Health Organization projects 82 million people worldwide will suffer dementia in 2030 and 152 million in 30 years' time. Mohammed Yusuf for VOA News, Kakamega, Kenya.
Fears are growing over a second wave of the coronavirus in many European countries as authorities halt opening up economies and societies in response to rising infection rates. Spain and Belgium are among the worst hit countries, with Britain and France also seeing an uptick of infections. Many scientists say the lockdowns were eased too fast and too early, and the measures may have to be reimposed to prevent a second wave of the virus. Henry Ridgwell reports from London.
A coronavirus test can be a painful experience. But in Spain's Catalonia region, there is a greater source of anguish.
It pains me that we could go right back where we started. It pains me. I think we had done well. Now I don't know if we are doing it well.
Catalonia has been at the center of a resurgence in coronavirus infections. Restrictions on movement were eased at the weekend, but several countries have imposed quarantine measures on travelers from Spain. Belgium and Luxembourg are also suffering a resurgence, with the Belgian city of Antwerp at the centre of a new outbreak.
I'm a little bit older man, and I am afraid, yes.
People are more scared to come out on the street.
Local officials say the government lifted the nationwide lockdown too soon back in May, ignoring hotspots like Antwerp.
If you don't respect physical distancing, that this infection spreads around very easily, and then it requests major measures to start controlling it again.
Such measures have been reimposed in parts of northern Britain, with different households once again banned from meeting indoors. Infection rates are rising, with an estimated 4,900 new infections every day across the country.
Early action is really critical. So if countries are responding, slowing down the reopening, making targeted changes to slow the spread of the virus, hopefully we can keep things in check before it kind of escapes onto that exponential growth pathway.
A wider easing of lockdown measures across Britain has been put on hold, with theatres forced to stay closed.
So we're going to have to make difficult choices as societies about the things we value the most. If, for example, our priority is to get our kids back in school in September, it may mean that we really don't want to have people in pubs and indoor restaurants right now.
In some parts of Europe, including Greece and Italy, infection rates remain low and tourists are returning.
The coronavirus is not something that greatly concerns us. We mostly look forward to relaxing and resting.
Germany has also seen an uptick in infections. In Berlin, around 20,000 people gathered to protest against lockdown measures Saturday. Authorities are prosecuting the protest organisers for breaking hygiene and social distancing rules. Henry Ridgewell for VOA News, London.
We're excited to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Still to come, a conversation with the UNAIDS Executive Director on how to significantly reduce mother-to-child transmission of HIV. We'll be right back.
You just high. Nina ukani luka buseni, ngachimweo kapena ni malaria. Let me love it when you come my way. Tumani baba when you walk away. I wanna make you my woman. I don't wanna waste no time. I say, hold up, my mama. You know I'm wanting you. I say, hold up, my mama. Can I be the one for you?
Hello, I'm Linor Moudou, your VOA health correspondent.
As you know, more than 2 months
During the
ago,
COVID-19 pandemic, the World Health Organization says most people who get COVID-19 have mild or moderate symptoms and can recover with proper supportive care. If you have a cough, fever, and difficulty breathing, seek immediate medical care. If you have fever and live in an area with malaria or dengue, seek medical care immediately. For more information on COVID-19, visit who.int or contact your local or national health authorities.
Welcome back to Africa 54. There are more than 4.7 million cases of coronavirus in the United States, and June statistics show unemployment is at over 11%. Senate Republicans and House Democrats remain at odds over a relief bill for American citizens. VOA's Isha Sarai has more.
A weekly $600 credit to unemployed Americans amid the coronavirus pandemic expired late last week, but Democrats are insistent on extending it through the end of the year.
We have been for the $600. They have a $200 proposal, which does not meet the needs of America's working families. And it's a condescension, quite frankly.
Republican leaders have argued that the $600 weekly credit would encourage some people to remain unemployed. A recent Yale University study said the credit did not discourage people from working.
There are cases where people are overpaid. There are cases where people are underpaid. The issue is we need to come up with an agreement to extend this.
Republicans are proposing close to $1 trillion in the HEALS Act, while Democrats are using the $3 trillion HERO Act passed earlier this year as their starting point in negotiations. Both sides have agreed that they are not near an agreement.
We have to balance. There's obviously a need to support workers, to support the economy. People who, through no fault of their own, are shut down because of this terrible disease. On the other hand, we have to be careful about not piling on enormous amounts of debt for future generations.
But lawmakers warn that as negotiations for economic relief continue, the country desperately needs to address the growing number of confirmed cases and deaths from the coronavirus.
In our negotiations, we're talking about dealing with some of the consequences of this pandemic. But the fact is we must defeat this virus. And that is one of the points that we still have not come to any agreement on.
As the deadline to pay August rent passed this weekend for many across the country and confirmed cases of coronavirus continue to hit record highs in multiple states, Americans await a way forward from Washington this week. Isha Sarai, VOA News, Washington.
In our health report, mother-to-child transmission of HIV is the spread of the virus from a woman living with HIV to her child during pregnancy, childbirth, or breastfeeding. Experts say mother-to-child transmission accounts for more than 90% of HIV infections in children and can be reduced to less than 5% by providing HIV-positive mothers access to effective antiretroviral therapy and support services. Africa 54 health correspondent Lino Mudu spoke with UNAIDS Executive Director Winnie Byanyima and discussed some innovative solutions to tackle the issue.
Now, a lot of progress has been made over the years, and as you mentioned, when it comes to addressing HIV/AIDS on the continent, one such progress has been prevention of mother-to-child transmission, not only in Africa, but also in other parts of the world. There have been progress on that front. Yet Nigeria has one of the highest rates of mother-to-child transmission in the world. So what can be done in Nigeria particularly?
You're so right. Some countries like small islands in the Caribbean, like Jamaica and others, have already eradicated mother-to-child transmission because the treatments are there that a mother can take to prevent her from passing it to her baby. But Nigeria and a number of other countries, not only Nigeria, are actually seeing reversals, are losing the ground on that. And why? We know why. It's mothers who don't come for antenatal and postnatal. So there are reasons, and they are very well researched, why many women don't come. Sometimes the service is too far away. Sometimes there are user fees. In this part of West Africa, user fees are stopping women from going to clinics. Do you know that in some countries, you have women being arrested after they've had their baby, they are held prisoners in the clinic until somebody goes and sells their piece of land or something to come and pay for being in the hospital to deliver a baby. That is how user fees are. They are violating human rights, and they are ridiculous, because while you're keeping her in the hospital, someone who needs the bed is not getting it, as you are trying to extort money from a poor person. Then you also have women who actually come, are put on treatment, but then fall out of care. There are also many reasons we have researched them why women and men even fail to stay on treatment. Very often the service is provided in ways that are so inconvenient. Too far away, you go there, you line up for a whole day, you've got to earn food for your children, you've left them at home, or you go there and they say they stock out, come back next week, come back the other day. Many things about services not being close enough and in ways that are accessible. Then there are also issues of hiding. Let's face it, many women are blamed for carrying the virus by their husbands. They keep it a secret.
Now let's talk about innovations, because, of course, doing the same thing over and over again may breed results, but it's important to come up with new ideas, new solutions. So what type of innovations is UNAIDS promoting or pushing for?
We work with scientists to spur innovations in science. That's one area. And like I've said, we still don't have a vaccine, we still don't have a cure. So we still are pushing companies, research institutions, universities to continue looking for a vaccine, but treatments. We have some treatments that are keeping people well, but there are gaps here and there. For example, we need better and better treatments for children. If you are a child and you are positive, your mother passed it to you, you're going to be on a tablet for the rest of your life. Think about a little girl of 6, 7, 8, 10, 12 keeping a secret about her tablet because she fears her peers. She would be better off if there was, say, an injection that she can have once in 6 months, but not hide every day to swallow a tablet. So better treatments that suit people where they are. The same with how young men don't want to go to clinics to test. We are now moving towards self-testing and even receiving your antiretroviral tablets at an ATM in a mall rather than to line up at a clinic. We need more innovations on prevention. We need more and more clever ways to change behavior, attitudes that are harmful and that encourage infection. So we need more innovations across the board.
That was Africa 54 health correspondent Lino Mudu speaking with UNAIDS Executive Director Winnie Byanyima. And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thank you for watching.